Let's talk about one of the most common overdoses we see in the emergency department, diphenhydramine. Diphenhydramine is a first-generation H1 blocker. H1 meaning we're blocking the action of histamine. And histamine does a lot of things in our body, but the one we're talking about with this is making itchy eyes and runny nose and hives and a mild allergic reaction. And I say first generation because it was one of the first histamine blockers that were developed. As a matter of fact, it was released in the United States in the 1940s, which was before the FDA did a whole lot of investigation on medications before it just YOLO'd it out on into the general public, which is why this medication has so many unintended side effects. And in a diphenhydramine overdose, we lose our ability to balance between our go and our slow. Our go is our sympathetic nervous system, where we have a heart rate increase, our pupils dilate, our blood pressure increases, our body gets hotter. But that's often balanced by our slow, our parasympathetic nervous system, the rest and digest, the salivate so that we can chew our food, the sweat so we can cool off our body, the smooth muscle contractions so we can digest our food and so that we can go pee and not have urinary retention. Well, why does it do that? So our diphenhydramine is a non-selective receptor blocker. And so we can't just focus it only on histamine. It also goes and blocks a whole bunch of other things. And one of those things are muscarinic receptors. Muscarinic receptors are where acetylcholine binds to. And acetylcholine is the neurotransmitter, meaning the messenger for our slow down system, our parasympathetic nervous system. So what happens if we lose our ability to communicate our parasympathetic, we get unopposed sympathetic nervous system. And so we get we're all gas, no brakes. And so it makes sense if you think about that anticholinergic overdose saying that we get, where the patient is red as a beet, hot as a hare, mad as a hatter, blind as a bat. Let's go through all of those and discuss why those happen in these overdose patients. So let's start with hot as a hare. So our body is getting warmer, warmer, warmer because we have unopposed sympathetic, but our body can't bind to those, that acetylcholine can't bind to those muscarinic receptors to say sweat to cool off the body. And then they get red as a beet because the body tries to compensate for that elevated body temperature by vasodilating to peripherally shunt blood to try to cool off. They're also dry as a bone because they can't salivate and they have urinary retention. We say mad as a hatter because these patients can experience psychosis, altered mental status, hallucinations, even seizures because this is affecting the work of so many of our neurotransmitters. And blind as a bat, these patients often complain of blurry vision because we have the go, 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 which causes our pupils to dilate, which then induces blurry vision. One of the scariest things we see in these patients is a wide QRS complex on their EKG. Now think about it for a second. On your EKG, your x-axis is time, your y-axis is amplitude. And if your usually narrow complex QRS is now wide, that just means that it's taking you more time, we're taking up more time to send that signal through the heart. And that's because this non-selective blocker also blocks our sodium channels, which makes it difficult for that signal to travel through the myocardium. So what are we going to do about that? We are going to flood the system with a whole bunch of sodium to interact that blocking of the sodium channels. And we use sodium bicarbonate, and we give that as a bolus until we see that QRS complex narrow up. Now, the other things that we do for these patients in a diphenhydramine overdose is, of course, supportive therapy. If they're so altered they can't maintain their airway, we might have to intubate these patients. If they are so vasodilated that their blood pressure is in the toilet, we give them a pressor. And also, to block the action of that anticholinergic overdose, we give physostigmine. So I hope that helps you understand a little bit more about a diphenhydramine overdose.